supported by Mearmont Treatment Center, progressive addiction recovery with a holistic approach. The following program contains graphic images. Viewer discretion is advised.
I'm waving an ambulance over to a girl who's dying on the sidewalk. Her lips are blue. Her friends are frantically trying to wake her. Ironically, the week before, I learned how easy it is to save somebody using Narcan. We didn't have any on us, so I called 911. For nearly half a year, me, Vince Latanzio, and my NBC10 colleagues Denise Nakano and Morgan Zalot have been reporting on the heroin epidemic. We've been trying to wrap our heads around not just how we got here, but mostly, what are we going to do about it?
When it comes to drugs, just say no.
We've already learned one thing. The war on drugs, it failed. And what if, for all those years, we were fighting the wrong enemy? To tell this story, we knew we needed to talk to users, law enforcement, mothers, activists, and lawmakers. Along the way, we encountered people who've ripped up the manual and are trying new ways to save a generation addicted. The heroin epidemic is personal to all three of us. For me, heroin took my cousin, Jesse. I was a teenager, and he was like my brother. 13 years later, I found myself reporting on a spike in overdoses from prescription painkillers and heroin. The problem had gotten exponentially worse. Why? Here's some quick background. Back in the 90s, there was a shift socially towards better pain management. Doctors prescribed more painkillers. Pharmaceutical companies made stronger drugs called opioids. Those are OxyContin, Vicodin, and Percocet. This trend exploded by 2012. Doctors wrote enough painkiller prescriptions to put a bottle of these highly addictive drugs in the hands of every man and woman in America. So, you get hurt. Doctor prescribes opioids, you get hooked. Or maybe you're a kid and you get hooked stealing pills, most likely from a family member. Either way, the prescription runs out, withdrawals are hell, and the opioids hijack your brain, compelling use. On the street, the going rate for painkillers is about $1 per milligram. If you're hooked, you may need around 160 milligrams a day. You have to make a lot or steal a lot to score. Why do that when you can get heroin, and even better high, for $10 a bag in Philly? Some of the cheapest and purest heroin in the entire country.
People come from all around. It's not just a Philadelphia problem. Delaware County, New Jersey, Montgomery County, Bucks County, they're coming here, right to this spot where we're standing, to get their heroin.
You probably know this spot as Kensington. It's part of an area police call the Badlands. It's the epicenter of drugs in Philly. Dealers on corners use needles littering the ground all over.
Now there's one sticking in the wall.
Is it? Chief Dan McDonald leads Philly PD's narcotics unit.
What we're seeing over the last 10 years, I mean, heroin was bad then, it is insanely bad now. From when I was a young cop out here working the streets to today, you're seeing the age of the users dropping. We were talking to a girl the other day, 22 years old, from Warrington, drives down here, her and her boyfriend. They're still inhaling, they haven't reached the level of shooting yet. And we had the conversation, it was like, you guys gotta stop. And you could see she's getting ready to cross that line. How long you been using? How'd you get involved with it? And they're telling us these things, and it's pills. And that progression is rapidly increasing, and you got kids from 17 into their mid to early 20s that are now involved in it.
Well, we call these the tracks. Everybody comes down here to get high because you need a place to go. You can't just do it on the street.
Meet Michael Miller, 22, from Philly's Tacony section. He was with us the day that woman nearly died. He made the jump from painkillers to heroin 2 years ago. Michael has overdosed and has had 4 friends die of drug overdoses in less than a year, including his friend Sean.
I watched him die, literally, and I couldn't do anything about it. And it sucks. He started ODing and I couldn't do anything. I tried everything I could, waking him up, and he just died right in front of me, and that scars you,
Remember that part about how opioids hijack your brain? Despite seeing his friends die and watching that woman overdose just 20 minutes before, Michael still went down to the tracks to shoot up, even knowing that our camera was rolling.
Take the needle, you get about 25, 30 cc's of water.
What's going through your head right now when you're getting ready to do this?
I'm about to feel great. It's like, and it's sick. Like, I don't want to do this, but I can't explain it. It's just.
How long will it take?
To feel it?
Yeah.
I felt it already. Instant, like I said.
Opioids retrain the brain. It becomes like food. You need it to survive. That physical and psychological dependence morphs quickly into a chronic disease like diabetes. So why is addiction so often seen as a moral failing? We traveled to the University of Maryland to see Dr. Bankole Johnson, a leading brain science expert.
It seems to be something that is very hard to get through of what a brain disease actually is like. And the best thing I can think of is an analogy. You are in a desert, for example, and you found an oasis, and the oasis had poisoned water. Well, the first day, and I told you that this water is poisoned in this oasis, you can't drink it, you probably won't. But by the second or the third day, you are going to be compelled to drink it, because that's just the way it is. Even though your rational brain knows that it's going to be bad for you, your rational brain knows that it's obviously going to kill you drinking this poisoned water, but your brain is so compelled. Once the person becomes addicted, the brain disease is so powerful that it's simply not possible to attribute the consequences of that to the person's social failing. And I think it's actually quite unfair to do so.
That's Sal. He looked there like he was carefree and he had no worries.
Yeah.
He truly, to me, looked happy in that picture, you know, and that life was good. And that's a Sal I always want to remember.
Heroin killed Sal Marchese. Sal's mother, Patty Dorenzo, and sister, Blake Marchese-Zatuski of Blackwood, New Jersey, spent 7 years battling the disease with him. The ups and downs, the times strung out and sober. Sal's life ended suddenly in his mother's car outside a Camden apartment project. He was 26.
It was his 90th day clean. He wasn't using at the time, so that was frustrating. And we don't know what happened. It was hard. Not that it would have been easier but if at the time he was actively using, it just would have made sense. I don't know, like it would have made, I just can't make sense of this. Like why did you do that?
I know that he was sorry. Like, I know that he didn't like who he was. And I feel like I could see the shame in his eyes.
For his entire fight, even with the support of Patty and Blake, the stigma put on addiction wore on Sal. It also prevented Sal from getting the care he needed. Patty and Blake fought to keep Sal in rehabilitation programs, but insurance limits and a lack of open spaces left him floundering.
I was diagnosed with stage 4 progressive breast cancer. Once I got that diagnosis, from that day on, I had everything I needed. I never had to make a call. I never had to beg for a chemo chair when I was going for my chemo treatments. Everything. And I still have medication I take daily. I still go see my oncologist. I get scans, everything to make sure that my cancer doesn't come back. And if it does, they'll take care of it and they'll treat it appropriately. Why didn't that happen with my son? You know, like, I feel like I shouldn't be here and he should. You know, I survived stage 4 cancer and my son died from the disease of addiction. No, something's wrong with that.
There's things that we do as parents. Some would say it's enabling. I don't know. I think there's a really fine line in doing whatever you have to do to get your kid that help.
I can say anything? Anything you want. Okay. Addiction it's the devil. It's the shadow that follows you everywhere you go.
Michael made the heroin epidemic personal for me. He's like a kid right out of my family, and every time I look at him, I see my own brother. They're the same age, both graduated from prestigious high schools, played sports, and we all had similar upbringings.
I look back on my life, like everything that I had and everything I gave up. I was going to Drexel, you know, and it sucks. Like, when you look, I feel like I can't get back to it, you know? I had so much going for me, and I feel like I just threw it all away. And that's a horrible feeling.
So how did Michael wind up on the tracks while my brother finished college? Each time we see him, he talks about this fall from goodness.
I feel horrible for the things that I've done. It's made me do things that I would have never thought I would have ever done in my entire life. I hate seeing my mom cry, the things I've done to her, stealing from her, and the person who supported me all her life and does everything for me, and it's crazy what the addiction does to you.
Addiction doesn't just dog the person who's battling it. It throws families of users into a dark, desperate place.
I know he's going to always come home because dinner's always here for him, and he has it good here. I mean, he's safe here. This is a safe haven right here. As soon as he walks out the front door, I don't know.
I visited Michael and his mom at their 2-bedroom apartment in Tacony.
In the hallway is the wall of Michael. So if you want to follow me to see the wall. That one right there. Squish him up.
That's horrible.
Squish him up.
Horrible.
He's a loved child.
Yeah, I can tell.
He's a loved child.
And, he talked a lot about how much he loves you and how hard it is for him that he knows that this has hurt you too, and how that's like one of the toughest parts for him.
Angel is a psychiatrist's assistant. It turns out she knows more than most of us about addiction, which adds a whole new layer of guilt for her.
You just don't think that it's going to come to your house. You don't think that that is going to happen to your family and to your only son, who for 20 years gave you no problems. And the funny thing is I'm able to help other people, but I couldn't help my own son.
Heroin isn't just a problem in Philadelphia. We travel to Pittsburgh, where parents are fighting this crisis in different ways.
I think people that were even our friends probably said, oh, both of their kids, what did they do wrong?
Laura Probst has spent years battling a heroin addiction with both her son and daughter. That led her to start the Pittsburgh chapter of a parent support group called Not One More.
We suffer post-traumatic stress syndrome from these things on a regular basis. There's things that we do as parents. Some would say it's enabling. I don't know. I think there's a really fine line in doing whatever you have to do to get your kid that help, okay? And I purchased heroin for my daughter or my son because they were going to treatment. I feel that it was the right thing, even now, but it's still hard to say because they're getting sick and they're going into rehab the next day, and it might be a Saturday or a Sunday and they won't see the doctor till Monday, and you don't want them to go through the excruciating pain of a withdrawal. I don't know, maybe a little afraid of opening up about this because I think there's a lot of judgment that could go on.
I try and tell people this, it's not your fault. It's not the parents' fault. It's nobody's fault. It's a disease that has taken over their brain.
Carol Rostischer roamed the streets of Kensington for hours at a time when her son was using. Sometimes he'd just disappear for days. She now runs Angels in Motion, a volunteer organization that takes care packages to active users. Her son's back in rehab, this time in Florida.
Recovery doesn't happen overnight. It doesn't always work the first time, the second time, the 5th time, the 10th time, but eventually, as long as there's breath, there's hope.
For Angel, the hardest part is not knowing how the story of Michael's battle ends.
I always said to him before Mommy dies, I want to see you accomplish something because I know you can. I know that you have the ability. You're smart. God gave you a brain. Use it. And I believe that he will. I believe it. I believe he's going to be one of those that's going to be okay.
Right now, he's on Suboxone, a medicine that blunts his cravings. But after one previous attempt to get clean failed, both know how delicate recovery is. Sal was on Suboxone too, for 3.5 years.
What happened?
He decided to stop taking Suboxone on his own. He said within hours he started getting cravings. I'm going to say 2 weeks with him being off the Suboxone, he was back on heroin.
Look how taken care of I was. I don't know all the crap I put them through. I can't help it.
It's hard.
We shouldn't be applying punitive approaches for people who have a disease. We don't do it with any other disease, and we shouldn't do it with addiction either.
It was pain pills originally, and then, you know, that became a habit after prescription, and then, you know, they became too expensive.
I started covering the heroin epidemic in depth 2 years ago.
It feels like I have like almost no option, or I feel like I almost have no control.
I was pulled in by how easily people like Carly and Haley get sucked into such a dark place. Like 80% of the kids who end up here to buy drugs, they were from the burbs. Haley was so desperate, she was selling her body to support her habit.
How many tricks do you turn?
I don't know, sometimes it could be like 4, sometimes it could be like 20, like, you know.
How can we fix this? That's the question I've been asking, we've all been asking, all the way to Washington. Michael Botticelli is the director of the White House Office of National Drug Control Policy.
We're not relying on arrest and incarceration as a way to deal with people with addictive disorders.
I mean, really, as you had mentioned, I think in your own words, more healing than handcuffs?
More healing than handcuffs. And again, I think, you know, historically we viewed people with addiction as bad people who were doing bad things. And, you know, our scientific understanding has changed dramatically, that we know that this is a disease and that we shouldn't be employing punitive approaches for people who have a disease. We don't do it with any other disease, and we shouldn't do it with addiction either.
We found an army of people trying to figure out a better strategy. Gary Tuggle runs Philadelphia's DEA field office.
About 120 people per day die of overdoses in this country. That's over 40,000 a year. If we were in a war zone, those would be considered mass casualties.
After 42 years, the federal agency is making a seismic shift in its approach in fighting drugs. In November, the DEA launched its 360 strategy in Pittsburgh, a compassion-based approach. Tuggle is overseeing that rollout.
We're never going to arrest our way out of this epidemic. It requires a multifaceted approach. We're still missioned to go after the biggest and baddest drug traffickers in the world, and we're very, very good at that. Where we haven't been so successful is engaging with the community. The new strategy calls for us to do a more intense partnering with the community, with education, treatment, prevention, so that we can get those community resources into the neighborhoods after we leave.
But for local police who see more kids dying in their own communities, change isn't happening fast enough. They've taken the fight into their own hands.
I'm frustrated, and I'm going to do what I can in this small corner of the world to try to make the difference.
In Bucks County, Fred Heron is launching an Angel program this month after seeing a spike in Ben Salem's heroin problem 3 years ago. No arrests for people who walk in and want help. Anyone from anywhere will get treatment free.
If that person reaches out to us and wants help, we're going to get them that help. We'll do whatever I have to do to get them that help.
I think that really this is more of a public health issue than it is a public safety issue.
In Camden, New Jersey, Police Chief Scott Thompson has embraced the change in strategy and given his officers new tools to combat the growing crisis. Camden County Metro Police carry Narcan, the drug that can bring heroin users back to life during an overdose.
I administered 1 dose of Narcan to both of the nostrils. Literally about 15 seconds later, you can start seeing the color come back to the individual's face.
What went through your head?
All I knew from that moment in time is that I must have did something right. Even though it was the first time I administered Narcan, something's definitely happening there.
Officer Tyrell Bagby has only been on the force for 3 years, but the 24-year-old has already administered Narcan 16 times. Every single person Tyrell's used it on has survived.
I have one of those great chances to say that I haven't taken a life, I've saved 16 lives.
I think that law enforcement should be a facilitator and a convener in this. We should be an entry point into an established system for people getting better and saving their lives. At the end of the day, we're all trying to prevent parents from burying their children.
Addiction is slavery.
Addiction is a chronic brain disease.
A deadly epidemic.
A public health crisis.
supported by Mearmont Treatment Center, progressive addiction recovery with a holistic approach.
Nearly half a year of reporting, more than 80 interviews, 18 cities large and small. We knew this was going to be a hard topic to report on, and it was, and we learned more than we could ever share with you in this program. Visit us now on Facebook, Instagram, and Twitter to hear more stories, watch extended interviews and exclusive videos, and to share your story. We don't claim to know all there is about this epidemic, but over the course of our reporting, there were a few lessons we learned that we felt important to share with you. Prescription painkillers put this epidemic into overdrive. You should be vigilant about taking them and keeping them under lock and key. Think twice before allowing your kids to take them, and doctors can be more responsible about prescribing them. 8 out of 10 heroin users are white, but folks cautioned us not to get too hung up on that, stressing that addiction doesn't discriminate. Narcan. Consider adding it to the first aid kit in your home or office. You don't even need a prescription to get it. Reducing stigma. If there's one thing all of us can do, this is it. Addiction is not a moral failing. It's a disease. Treatment. There's not enough of it, and it's not good enough. Treatment has to get better. There is hope. And what if enough of us commit to rewriting the story on addiction?
Addiction is slavery.
Addiction is a struggle.
Addiction is a chronic brain disease,
a deadly epidemic,
a public health crisis.
Addiction is not your fault.
Addiction is not a moral failing.
Addiction is killing a generation.
Addiction is real.
Addiction is not hopeless. Ask yourself, what does addiction mean to you? Let us know. Take your smartphone, record a video, and share it with us through the NBC10 app. And join the people you met in this program and dozens of others who are standing up and speaking out about addiction.